Hey everybody, Dr. Jared here, and today I wanted to give 2 tips for POTS patients. Now, POTS stands for Postural Orthostatic Tachycardia Syndrome, which in fancy words basically means if somebody stands up too fast, the body's supposed to increase blood pressure, so that way you keep blood in your noggin, you stand up, everything's okay, and then you go on about your day. But what happens is the heart starts to beat a little too fast and blood pressure actually drops. So this can be a big issue, especially when we think of what a head injury can do to make things even worse, because we don't want to pass out and hit our heads. So when we're getting to the bottom of things with my POTS patients or my dysautonomia patients, some of the kind of easy tips I'll give them is if we're going to go from sitting to standing, something we can do is kind of brace, or like we're going to maybe start pushing a car and our abdomen's really braced. It's called a salva maneuver. What this does is that increases a little bit of blood pressure up through here, so that way we can try to keep blood in our brain while we're standing up. Then you can count to 1, 2, 3, 4, slowly exhale after the people stand up. Usually that can help a little bit too. Also, another tip that I'll give is we want to start kind of maybe grooving that pattern in the brain without taxing it too much. So I'll have somebody, maybe as they're laying down, I'll have them start by lifting their head up, because moving the ear canals and the neck, that'll also start to signal some of these pathways that we're going to change position and things like that, to get the part of the brain that controls blood pressure and heart rate and all that ready to start moving and shifting around. So that way we can maybe kind of prepare things a little bit better, so that way we don't have the tendency to maybe pass out as much. So that way especially we're not hitting our heads or anything like that. I hope that helps.